Welcome to Health Organizers, your digestive system specialist. In our Health Bites, we strive to provide you with just enough information to chew on so that you can better understand how to care for your digestive system, also known as your hole in the middle. On this edition of Health Bite, we will be discussing ulcers and heartburn. Now, ulcers and heartburn can be caused by one main factor, which is hydrochloric acid, or HCl, also known as your stomach acid. Now, we can have an excess of stomach acid, which can lead to those symptoms. When we have an excess of stomach acid, it can be caused by a bacteria called H. pylori. It can also be caused by certain tumors that will cause the body to produce too much stomach acid. Now, a more common but lesser known reason that a person could have heartburn is actually insufficient stomach acid or not enough stomach acid. And this is because oftentimes when we don't have enough stomach acid, you can think of it as being this lower hand here, and the bottom of your esophagus, the tube that carries your food to your stomach, being this top hand here. And stomach acid, when it's high enough, can let that sphincter, that muscle that stays closed so food doesn't go back up, know that it needs to stay closed. But when we don't have enough stomach acid, if it's too low, then sometimes that muscle can open up a little bit, and the stomach acid that we do have can actually rise back up and lead to symptoms of heartburn. So that's lesser known, but actually very common. Now, the reason that a person may not have enough stomach acid could be because of pharmaceutical medications, antacids, also nutritional deficiencies, as well as an overactive immune system, an immune system that is attacking stomach cells and not allowing it to produce stomach acid. We can also have symptoms of heartburn and also development of ulcers when we have anxiety. So when we are very anxious, persistently and anxious over time, over a long period of time, then we have an excess production of a hormone that's called cortisol. And cortisol can help destroy the lining of the stomach that would protect the stomach from the acid, because acid is very strong and it definitely will burn, and it can destroy the stomach itself if it wasn't for that coating. But again, when we have too much cortisol, then we can erode or kind of diminish that lining of the stomach, and then the stomach's own acid burns the stomach. Now remember that symptoms are the body's alarm that there is a problem and we need to investigate it. So merely covering up a symptom without looking for the underlying cause is just like being awakened at midnight by your fire alarm. You get up, you turn off the fire alarm, but you don't check for smoke or a fire. That's dangerous because you go back to sleep and now the fire alarm is off, but the fire is on. So what is a persistent symptom? Think of the rule of ones. If it occurs more than one time a day and more than one day a week, then it's persistent. That concludes this edition of Health Bite on ulcers and heartburn. Be sure to visit us on the web, healthorganizers.net. Like us on Facebook. Follow us on Twitter. I'm Dr. Megan Laban, and remember, Health Organizers, working with you to tidy up your health naturally.